Welcome to our journey into pharmacogenomics, a field at the intersection of pharmacology and genomics. Imagine a world where your medications are tailored specifically for you, based on your unique genetic makeup. Pharmacogenomics makes this possible by studying how our genes influence our response to drugs. This approach aims to optimize drug therapy, ensuring maximum effectiveness with minimal side effects. As we explore this fascinating subject, you'll discover how genetics can impact everything from painkillers to cancer treatments. Let's begin by understanding the basics of this innovative science and why it's becoming increasingly important in modern healthcare. Pharmacogenomics has its roots in both pharmacology, the study of drugs, and genomics, the study of genes and their functions. By combining these two disciplines, scientists can better understand why people respond differently to the same medication. This field emerged as researchers noticed that some patients experienced unexpected side effects or failed to benefit from standard drug doses. With advances in genetic research, it became clear that our DNA plays a significant role in how we metabolize and react to medications. This realization set the stage for a new era in medicine, one that prioritizes individualized care. Genes carry instructions for making proteins, including enzymes that help process medications in the body. Variations in these genes can affect how quickly or slowly a drug is broken down, which in turn influences its effectiveness and safety. For example, some people may need higher doses of a medication, while others require less to achieve the same effect. Understanding these genetic differences is at the heart of pharmacogenomics. By identifying specific gene variants, healthcare providers can predict which drugs and doses are likely to work best for each individual. Pharmacogenomics is a driving force behind the personalized medicine revolution. Instead of a one-size-fits-all approach, doctors can now use genetic information to select the most appropriate medication and dosage for each patient. This not only improves treatment outcomes, but also reduces the risk of adverse reactions. Personalized medicine is transforming healthcare by making it more precise, predictive, and proactive. As genetic testing becomes more accessible, more people will benefit from therapies tailored to their unique genetic profiles. Genetic testing is a key tool in pharmacogenomics. It involves analyzing a person's DNA, usually from a blood or saliva sample, to identify specific gene variants that affect drug metabolism. The results can help doctors determine which medications are likely to be most effective or which ones to avoid. This process is becoming faster and more affordable, making it increasingly available in clinical settings. Genetic testing empowers both patients and healthcare providers to make informed decisions about treatment options. Several genes are commonly tested in pharmacogenomics to guide drug therapy. For example, the CYP450 family of enzymes plays a major role in metabolizing many medications. Variants in genes like CYP to D6, CYP to C19, and CYP to C9 can significantly impact how drugs are processed. Other important genes include TPMT, which affects response to certain cancer drugs, and VKORC1, which influences blood thinner effectiveness. Testing for these genes helps clinicians personalize treatments and avoid potentially harmful drug interactions. Let's look at how pharmacogenomics is applied in real-world healthcare. Imagine a patient who needs a blood thinner like warfarin. Genetic testing can reveal if they have variants in the VKORC1 or CYP to C9 genes, which affect how their body processes the drug. With this information, doctors can adjust the dose to minimize the risk of bleeding or clotting. This approach is also used for antidepressants, pain medications, and cancer therapies, ensuring safer and more effective treatments. Pharmacogenomics offers numerous benefits for patients and healthcare systems. By tailoring medications to an individual's genetic profile, it can improve treatment effectiveness, reduce the risk of side effects, and prevent adverse drug reactions. This leads to better patient outcomes, fewer hospitalizations, and lower healthcare costs. Additionally, pharmacogenomics can help identify patients who may not respond to certain drugs, allowing for alternative therapies to be considered sooner. Despite its promise, pharmacogenomics faces several challenges. Not all genetic variants that affect drug response are known, and some drugs are influenced by multiple genes or environmental factors. There are also concerns about the cost and accessibility of genetic testing, as well as privacy and ethical issues related to genetic data. Ongoing research is needed to expand our understanding and address these limitations, but the field continues to advance rapidly. Ethics play a crucial role in pharmacogenomics. Genetic information is sensitive, and there are concerns about privacy, data security, and potential discrimination. It's important for healthcare providers to obtain informed consent before conducting genetic tests and to ensure that patients understand how their data will be used. Laws and guidelines are in place to protect individuals, but ongoing vigilance is necessary as technology evolves. Cancer treatment is one area where pharmacogenomics has made significant strides. By analyzing the genetic makeup of both the patient and the tumor, doctors can select targeted therapies that are more likely to be effective. This approach has led to the development of drugs that specifically attack cancer cells with certain mutations, sparing healthy cells and reducing side effects. Pharmacogenomics is helping to usher in a new era of precision oncology. Psychiatric medications, such as antidepressants and antipsychotics, often have variable effects from person to person. Pharmacogenomics can help identify which drugs are likely to work best based on a patient's genetic profile. This can reduce the trial and error process that is common in mental health treatment, leading to faster relief and fewer side effects. As research continues, pharmacogenomics is expected to play an even greater role in psychiatry. Any cardiovascular drugs, such as blood thinners and cholesterol-lowering medications, are influenced by genetic factors. Pharmacogenomic testing can help determine the best drug and dose for each patient, reducing the risk of complications like bleeding or ineffective treatment. This personalized approach is especially important for drugs with narrow therapeutic windows, where small changes in dose can have big effects. Pain medications, including opioids, can be affected by genetic differences in drug metabolizing enzymes. Some people may process these drugs too quickly or too slowly, leading to inadequate pain relief or increased risk of side effects. Pharmacogenomic testing helps identify these differences, allowing doctors to choose the safest and most effective pain management strategies for each patient. Children are not just small adults when it comes to medication. Their bodies process drugs differently, and genetic factors can play an even bigger role. Pharmacogenomics is helping to improve pediatric care by guiding drug selection and dosing based on a child's unique genetic profile. This approach can prevent adverse reactions and ensure that young patients receive the most appropriate treatments. Older adults often take multiple medications and may have age-related changes in drug metabolism. Pharmacogenomics can help identify which drugs are safest and most effective for elderly patients, reducing the risk of drug interactions and side effects. This personalized approach is especially valuable in geriatric medicine, where the goal is to maintain quality of life and independence. Pharmacists play a key role in implementing pharmacogenomics in clinical practice. They help interpret genetic test results, educate patients and healthcare providers, and ensure that medications are used safely and effectively. As pharmacogenomics becomes more integrated into healthcare, pharmacists will continue to be essential members of the care team. For pharmacogenomics to be successful, healthcare providers need to be educated about genetic testing and its implications. Training programs and continuing education are helping doctors, nurses, and pharmacists stay up to date with the latest advances. This ensures that patients receive the full benefits of personalized medicine. Pharmacogenomics empowers patients by giving them more information about how their bodies respond to medications. With this knowledge, patients can participate more actively in their healthcare decisions. This collaborative approach leads to better adherence to treatment plans and improved health outcomes. Insurance coverage for pharmacogenomic testing varies widely. Some tests are covered for specific conditions or medications, while others may not be reimbursed. As evidence of the benefits grows, more insurers are beginning to recognize the value of personalized medicine. Patients and providers should check with their insurance plans to understand what is covered. Direct-to-consumer genetic testing kits are now available, allowing people to learn about their genetic makeup without a doctor's order. While these tests can provide useful information, it's important to interpret the results with caution and consult a healthcare professional before making any medication changes. Professional guidance ensures that genetic information is used safely and effectively. With the rise of genetic testing, data security has become a major concern. Protecting sensitive genetic information from unauthorized access is essential. Healthcare organizations use advanced security measures and follow strict regulations to safeguard patient data. Patients should also be aware of their rights and ask questions about how their information is stored and used. Pharmacogenomics is making an impact worldwide, with research and clinical programs in many countries. Differences in genetic backgrounds across populations mean that findings from one region may not always apply elsewhere. International collaboration is helping to expand our understanding and ensure that the benefits of pharmacogenomics are accessible to people everywhere. Pharmacogenomics is shaping the future of drug development. Pharmaceutical companies are using genetic information to design drugs that are more effective for specific groups of patients. This targeted approach can speed up the development process and reduce the risk of side effects. As our understanding of genetics grows, we can expect even more innovative therapies in the years ahead. Rare diseases often have a genetic basis, and pharmacogenomics is helping to identify new treatment options for these conditions. By understanding the specific genetic mutations involved, researchers can develop therapies that target the underlying cause. This approach offers hope for patients with rare diseases who previously had limited treatment options. Big data is playing an increasingly important role in pharmacogenomics. By analyzing large datasets of genetic and clinical information, researchers can identify patterns and discover new gene-drug interactions. This data-driven approach accelerates research and helps bring personalized medicine to more patients. Artificial intelligence, AI, is revolutionizing pharmacogenomics by helping to analyze complex genetic data. AI algorithms can quickly identify relevant gene variants and predict how they might affect drug response. This technology is making it easier for healthcare providers to interpret genetic test results and make personalized treatment recommendations. Pharmacogenomics has the potential to improve public health by reducing adverse drug reactions and increasing the effectiveness of treatments. Public health initiatives are beginning to incorporate genetic testing into population health strategies, aiming to prevent medication-related problems on a larger scale. Clinical trials are increasingly using pharmacogenomic data to select participants and tailor treatments. By matching patients with therapies based on their genetic profiles, researchers can improve trial outcomes and speed up the approval of new drugs. This approach is making clinical research more efficient and effective. Patient education is crucial for the successful implementation of pharmacogenomics. Patients need to understand what genetic testing involves, what the results mean, and how this information can be used to guide their treatment. Educational materials and counseling can help patients make informed choices and feel confident in their care. Chronic diseases like diabetes, heart disease, and asthma often require long-term medication. Pharmacogenomics can help identify the most effective drugs and doses for managing these conditions, reducing the risk of complications and improving quality of life for patients. Pharmacogenomics is also being used to improve the treatment of infectious diseases. For example, genetic testing can help determine the best antiviral or antibiotic for a patient, reducing the risk of resistance and improving outcomes. This personalized approach is especially important as new infectious diseases emerge. Lifestyle factors such as diet, exercise, and smoking can interact with genetic factors to influence drug response. Pharmacogenomics takes these factors into account, helping to create truly personalized treatment plans. By considering the whole person, healthcare providers can achieve better results. Despite its promise, there are barriers to widespread implementation of pharmacogenomics. These include limited access to genetic testing, lack of provider education, and concerns about cost and reimbursement. Addressing these barriers will require collaboration among healthcare providers, policymakers, and industry leaders. Health equity is an important consideration in pharmacogenomics. Ensuring that all patients have access to genetic testing and personalized treatments is essential for reducing health disparities. Efforts are underway to make pharmacogenomics more inclusive and accessible to diverse populations. Drug safety is a top priority in healthcare. Pharmacogenomics helps identify patients who are at risk for adverse drug reactions, allowing for safer prescribing practices. This proactive approach can prevent serious complications and improve patient trust in their care. Drug labels are beginning to include pharmacogenomic information, helping doctors make better prescribing decisions. This information can indicate which patients may need a different dose or alternative medication based on their genetic profile. As more drugs include this data, personalized medicine will become standard practice. Regulatory agencies like the FDA are playing a key role in advancing pharmacogenomics. They provide guidelines for genetic testing and drug labeling, ensuring that new therapies are safe and effective. Collaboration between regulators, researchers, and clinicians is essential for the continued growth of this field. Clinical guidelines are being updated to include pharmacogenomic information. These guidelines help healthcare providers incorporate genetic testing into routine care, ensuring that patients receive the most appropriate treatments. As evidence grows, more guidelines will reflect the importance of personalized medicine. Ongoing research is essential for advancing pharmacogenomics. Scientists are continually discovering new gene-drug interactions and developing better testing methods. This research is supported by collaborations between academic institutions, healthcare organizations, and industry partners. Real-life patient stories highlight the impact of pharmacogenomics. Many people have benefited from personalized treatments that improved their health and quality of life. These stories inspire hope and demonstrate the value of integrating genetics into everyday healthcare. The future of pharmacogenomics is bright. As technology advances and our understanding of genetics deepens, personalized medicine will become more common. Patients can look forward to safer, more effective treatments that are tailored to their unique needs. The journey is just beginning and the possibilities are endless. If you're interested in pharmacogenomics, talk to your healthcare provider about whether genetic testing might be right for you. Many hospitals and clinics now offer these services, and your doctor can help you understand the benefits and limitations. Taking the first step toward personalized medicine can lead to better health outcomes. There are many resources available for learning more about pharmacogenomics. Reputable websites, patient advocacy groups, and healthcare organizations offer information and support. Staying informed will help you make the best decisions for your health and well-being. Summary: pharmacogenomics is transforming medicine by making treatments more personalized, effective, and safe. By understanding how our genes influence drug response, we can achieve better health outcomes and reduce the risk of side effects. As research continues and technology advances, pharmacogenomics will play an even greater role in healthcare. Thank you for joining us on this journey into the future of medicine.